For dry lab review. I'm sure you're all overwhelmed by the amount of structures on this test, and there are quite a few. So what I thought I would do is record I guess, mini lecture of the hand. The hand is pretty involved. There's a lot of structures to go over. So what I thought I would do is I'm going to use one single model, and if you want to follow along with this lecture, you can pull up this hand model here. So this is in your dry lab manual. Looks like it's pages 56 through 58. And I'm going to go over these three pictures and go over as many structures as I can. And any remaining structures of the hand we can talk about during lab this weekend. So again, 56, 57, 58. All right, so this first picture that we're looking at here is a Palmar view of the hand, and it's the most superficial view we have of this model. So there's, let's see, 6 structures that I labeled here, and I'll see if I can pick out a few more to go over. So number 1, this is your palmar aponeurosis. Okay, it's a big, thick, sort of a soft tissue tendinous connection. And if you remember from lab last week, some of the groups, I think we went over the palmaris longus tendon, which is number 2 here. This is going to extend from the forearm and connect right on to the palmar aponeurosis here. It's a very strong connective tissue, helps a lot with grip. You can see how it kind of overlays those tendons there that we're going to review here in a bit. So yeah, 1 is your palmar aponeurosis. 2 here is your palmaris longus tendon. And remember, the unique part about that tendon is how it overpasses the flexor retinaculum, or it's superficial to the flexor retinaculum, which you can kind of see buried underneath there. And then the other structures here labeled at number 3 are also superficial to the flexor retinaculum, and that is your ulnar your ulnar nerve and your ulnar artery. Remember, ulnar refers to the pinky side of the hand, okay, or the medial side. And then if we move over to this side, you have here your radial artery referring to the thumb, or lateral side. So it's your radial artery, which isn't numbered, 3 being the ulnar artery and the ulnar nerve. Okay, so we're going to move up a little bit into the hand here. Again, the aponeurosis there kind of intertwines into these connective ligaments in the fingers on the palmar side. And number 4 is going to be your cruciform ligament, or I think in your lab manual it's referenced as the cruciform pulley of the flexor sheath. Okay, cruciform just means cross, so that ligament is a cross section or a crossing ligament, as opposed to number 5 there, which is your annular ligament or annular pulley of the flexor sheath. And annular means ring, so it makes sense that on this model you can, kind of easily see how obvious that's a very, ring type structure. And then 6 here, what we're looking at are your palmar digital arteries and nerves. So again, the name kind of says what it is. We're on the palmar side of the hand. Digital is in reference to the digits here. Your proximal, middle, and distal phalanx are what make up your digit, arteries and nerves. And those sort of come up, and when we get a deeper look at what's going on underneath the aponeurosis, you'll see how these form and travel distal up to the fingertips into these little capillary kind of arteries going on up there. Okay? Next slide, or next image. We're getting a little deeper here. I guess I would call this your intermediate layer. a lot going on, and I apologize for all the arrows and numbers, but I figured that was the best way to organize this. So let's start on the palm side, or I'm sorry, on the thumb side of the palmar surface here. We got a group of muscles that make up that big meaty part of your thumb. And last week in lab, in some of the groups, we were talking about the different motions of the thumb being flexion, extension, abduction away from the palm, adduction towards the palm, and opponens, or I'm sorry, opposition, opponens being the muscle that performs that. So if we look at number 1 here, we're going to call number 1 the abductor pollicis brevis. Okay, so that's going to abduct the thumb away from the palm, attaching down here, kind of at your scaphoid bone. Probably inserts a little bit there at the trapezium and works up towards that connective tissue where it inserts on the digit. Number 2, underneath that big meaty bone is your flexor pollicis brevis, which will flex the thumb. And remember, flexion is in reference to the plane of the hand. Or the palm, yeah. 3, kind of hiding in behind here, and we'll get a better look at it in the next picture, is your adductor pollicis, or adductor pollicis. Okay. And then underneath these 2 big ones, and we'll see it in the next image, is going to be your opponens pollicis. Now it's important to remember that the thenar compartment is all median nerve. Okay, but the adductor pollicis muscle, that web-like muscle, is ulnar. So if you have a median nerve pathology like carpal tunnel, thumb adduction is going to be preserved because ulnar nerve supersedes or goes over the flexor retinaculum. It's not involved there like the median nerve would be. So that adduction will be preserved. Good little clinical ruling out differential diagnosis. Number 4, we're moving over onto the hypothenar, or the ulnar side, where the pinky, the digiti minimi. We got a group of muscles that make up that hypothenar eminence. Number 4 is going to be the abductor digiti minimi. Okay, it's going to abduct the pinky independently. 5 is going to be the flexor digiti minimi brevis, because we do have a longus. And deep to that, which we can't see in this picture, but we'll see it in the next, is going to be the opponens digiti minimi. 7, I'm sorry, what number are we on? We're on 6, but I don't see 6, I'm sorry. What 6 was, which it looks like I messed up, was I was looking at these tendons here that travel all down into the digits there, and they're on the palmar surface, so we're looking at flexion. You can imagine if those tendons are pulled tight, you're going to flex the digits. That is your flexor digitorum superficialis tendons. Okay, these white tendons here that go underneath the sheath. 7 is the first lumbrical, and you can see the lumbricals for each digit here. The lumbricals are interesting, and we've gone over how that lumbrical grip is formed. They are going to exist on the palmar surface and flex the MCP, because you can see how they kind of they do attach there on that MCP joint, but they're also going to wrap around and hook up with that extensor hood of the digit and keep the distal digits extended as you flex your MCP. So as all the MCP joints flex, the rest of the finger the length of the finger remains extended because of how those lumbricals pull on the extensor hood and that extensor connective tissue. 8, that flexor retinaculum, okay? Very obvious structure there, how it's just that connective tissue that wraps the palmar surface there right at the wrist. Common site for median nerve impingement, carpal tunnel syndrome. Some patients will actually have that retinaculum released by a surgeon when carpal tunnel syndrome is present. It's one form of intervention, surgical intervention, that can relieve some of the impingement. 9 is going to be the deep palmar arch. I'm sorry, superficial palmar arch. We're in the intermediary layer here. So that superficial palmar arch is right there. And branching off of that palmar arch, you can see are these arteries here, which are tough to see because they kind of blend in with the lumbricals, but those are your common palmar digital arteries, okay? Common palmar digital arteries. And those branch off that arch. And if you look here, I'm going to skip to 12 because the radial artery is 12 on the thumb side. And that superficial branch of the radial artery is what is going to come and meet up and form that superficial palmar arch, and anastomosis here with the ulnar artery. 11 there is going to be your superficial ulnar nerve. So you can see how the ulnar nerve, that big fat nerve there, is going to branch off and stay on top, superficial. It's not going to go deep like this guy here, and we'll get into that in the next image. All right, third and final image is our deep, and I messed up the numbers here, I can already see it, but that's okay. We'll survive. So this is the deepest layer of the palmar surface. Number 1 there is going to be your adductor, adductor pollicis, so that we already mentioned because we could see it before. And the adductor pollicis here, you can see has this, it has 2 heads. It has a transverse head that travels directly across to hook onto the thumb there. And it has this oblique head, which is coming at an angle superior laterally to connect and meet up with the transverse head. Ulnar nerve. Number 2 is that Opponens pollicis. Opponens pollicis muscle, deep to the flexor and abductor pollicis. Moving over to the other side of the hand, on the hypothenar, you have the Opponens digiti minimi. Those Opponens muscles on both sides are real deep. Really deep. And we'll travel more into the inside of the hand here. Number 4 is going to be your palmar interossei muscle. Remember, with the interosseus, we have them on the palmar side and the dorsum of the hand. PADS and DABS is a little, I guess, acronym that is valuable and worth remembering. PAD, P-A-D, so the palmar interossei are going to adduct, PAD. And then on the opposite side, DAB, they will abduct on a dorsal interossei. Now be careful here because this arrow is kind of pointing to that artery, and I apologize. What that artery is going to be your deep, your palmar metacarpal arteries, which are going to branch directly off of these deep palmar arch. So you see, here's your deep palmar arch, okay? And off of those, much like you have in the last picture here with the superficial palmar arch with the common palmar digitals, here at the deep palmar arch we have the palmar metacarpal arteries, because those are running directly over those metacarpals. And I think that's what I'm pointing to there on number 6. 6A we'll call it, because 6B or the other 6 here are your deep ulnar nerve and deep ulnar artery. And you can that's a nice picture here, because you can see how they branch off the main artery and nerve and dive into the retinaculum there. I think that's all I have labeled on this model. So I hope that gave a little better idea of what we're looking at with this model in particular, that palmar surface of the hand. Now there's some other models in your lab manual that we can go over in lab, and those will be, and here's some other views. Here's a great picture of that cruciform ligament, your annular ligament, right? That annular ligament is that ring shape. And then the palmar digital arteries and nerves traveling up the digit. And you can see that nice big fat tendon there, that flexor digitorum, superficialis tendon. There's your adductor pollicis. That's a good look there. Extensor retinaculum, extensor digitorum, tendons. Okay, so the other models are here too to look over. Same structures for the most part. I like this model too. It's a little more clear, but I thought the other model was more, I guess, detailed is the way I would put it. You can use both models, and both models are potential test items. So study them, know them, ask questions if you have them, and we'll see you guys this weekend. Good luck studying. Thanks.